601 fatalities. Here in Georgia, there are 620 cases and 25 deaths attributed to that. There is still only one case in Bibb County, and it is not a fatality, thank goodness, that I'm aware of. However, we continue to get information from a variety of sources. I am aware of actions taken by other communities in the state of Georgia. Athens issued a shelter-in-place order. Augusta, Columbus, and Warner Robins have all declared states of emergency and closed certain businesses and put certain restrictions on social gatherings. I've continued to review articles and information that has come to my attention, and I have received I've received input and information from several of our Macon-Bibb County commissioners who each wanted to take some action and some steps, and I have certainly taken that into consideration, and I consider this a group effort, as I am the mayor and member of the commission and speak for the mayor and commission. We have also had a personal admonition from the CDC to lean forward into this situation and not do nothing, or worse yet, fall behind the curve, which could very easily result from doing nothing. But also a message from Dr. Emily Landon, University of Chicago epidemiologist, was especially significant for me, and I hope I can play this little 2-minute audio of Dr. Emily Landon for you. If it is preceded by an advertisement, which sometimes these things do, I disclaim the ad, and stay tuned. Let's see if we can't hear from Emily Landon.
This virus is unforgiving. It spreads before you even know you've caught it. And it tricks you into believing that it's nothing more than a little influenza. For many of us, it may not be much more than the flu. And so it can be very confusing as to why schools are closed, restaurants are shuttered, and now the virus is taking what's left of our precious liberty. But the real problem is not the 80% who will get over this in a week. It's the 20% of patients, the older, those that are immunocompromised, those that have other medical problems, who are going to need a bit more support, some oxygen, or maybe a ventilator, life support. We do amazing things like this to save patients in our American hospitals and across the world every single day, but we can't take care of everyone at once. And we can't keep that low mortality promise if we can't provide the support that our patients need. There's no vaccine or readily available antiviral to help stem the tide. All we have to slow the spread is distance, social distance. And if we let every single patient with this infection infect 3 more people, and then each of them infect 2 or 3 more people, there won't be a hospital bed when my mother can't breathe very well, or when yours is coughing too much. So in my house, we've made a lot of sacrifices. We don't go out anymore. This is the first time I've left my house in some days because I'm leading our efforts and emergency planning from my home. These extreme restrictions may seem, in the end, a little anticlimactic because it's really hard to feel like you're saving the world when you're watching Netflix from your couch. But if we do this right, nothing happens. Yeah. A successful shelter in place means that you're going to feel like it was all for nothing. And you'd be right. Because nothing means that nothing happened to your family. And that's what we're going for here.
As I say, I found her message to be especially pertinent and meaningful. Our previous actions that we have taken here locally have tried to convey our individual responsibility to be aware, knowledgeable, and compliant with steps to be taken. Focus on social distancing and personal sanitation, hygiene to avoid contracting or transmitting the virus, and self-quarantine if you develop symptoms of fever, cough, or shortness of breath, so we avoid spreading the virus to our more vulnerable citizens, because for them, the morbidity levels are significantly increased, and our hospitals could be overwhelmed with patients. My comments at the last press conference on Thursday were an attempt to re-emphasize that message, but if my comments were misconstrued by some to be cavalier or indifferent, I regret that. And that certainly has not been my attitude or my outlook. This is serious, but we, as I'll say again, as a community, will get through it. But it is vital that we prevent the spread of this virus, especially to our elderly or medically fragile citizens. Since last Thursday, it has become evident that far too many of us are not taking this virus seriously enough. So I have decided to take the next step. Today, I am declaring a state of emergency in Macon-Bibb County and requiring that certain businesses close or modify their operation for the next 2 weeks. Hopefully, this will be effective in slowing the spread of the virus, and we will not have to take even more drastic measures. We know that transmission of the virus is a function of distance and time. The closer in proximity you are to another, and the longer a period of time that you are in that proximity increases significantly your chances of contracting this virus. So this order requires that non-essential businesses that put people together in close proximity for significant periods of time be closed for the next 2 weeks, and social gatherings be limited to 10 or fewer people. This order is intended to modify our collective behavior and minimize the transmission of this virus. The order, which I'll hand out momentarily, reads in pertinent part the last whereas paragraph, saying, whereas to prevent or minimize injury to people resulting from this pandemic, I, Robert A.B. Reichert, as mayor of Macon-Bibb County, find that certain actions are required, including but not limited to the social distancing measures as set forth herein. Now, therefore, by the power vested in me as mayor of Macon-Bibb County, it is hereby ordered that Macon-Bibb County is declared to be under a state of emergency, which shall continue until April the 6th, 2020, unless extended by subsequent order. All public or private community gatherings of more than 10 people anywhere within Macon-Bibb County are prohibited during the duration of this order, and yes, that would include religious services. A community gathering does not include the following or similar uses, as long as attending the same, generally not within 6 feet of each other for extended periods, governmental operations, spaces where persons may be in transit or waiting for transit, such as airports, bus stations, or terminals, child care or adult care facilities, residential buildings, or any type of temporary sheltering or housing, grocery stores or pharmacies, hospital or medical facilities, educational institutions engaged in medical and engineering or other efforts by students and faculty to deal with the impact of COVID-19, and the performance of job duties by persons not exhibiting symptoms of COVID-19 or residing with any person exhibiting those symptoms. Notwithstanding the previous section, the following business categories will be regulated. Restaurants shall close to the public except to provide takeout, delivery, drive-through, or curbside service. Bars, taverns, and similar establishments shall be closed for business. All establishments providing body care services which require physical contact between the provider and client, including without limitation barbering, hair design, cosmetology, aesthetics, massage therapy, tattooing, body waxing, tanning salons, or nail care shall be closed for business. All indoor recreation facilities, including without limitation gymnasiums, health studios, yoga, pure bar, spin, or other fitness classes, spas, saunas, indoor amusement facilities, arcades, bowling alleys, pool halls, movie theaters, playhouses, and concert venues shall be closed for business. All other retail, commercial, and industrial establishments will be permitted to remain open, subject to the following restrictions. Reasonable steps are taken to ensure that customers, employees, and other persons on the premises shall generally not be within 6 feet of each other for longer than brief periods, and employees are not suffered or permitted to work if they are exhibiting symptoms of COVID-19 or residing with anybody exhibiting those symptoms. Bowden Golf Course, all Macon-Bibb tennis facilities, and all Macon-Bibb County owned facilities at Lake Tobosoffke, including without limitation Claystone Park, Arrowhead Park, and Sandy Beach Park, shall be closed for business. All permits for special events, including park facility rentals to be held on Macon-Bibb County property for the duration of this order, are hereby canceled. Pursuant to Section 9-12 of the Macon-Bibb County Code of Ordinances, violation of any of these paragraphs carries a fine punishable by up to $1,000 per violation and or imprisonment not to exceed 60 days. This order will become effective 6 hours after the time indicated below and shall remain in effect through and including 11:59 p.m. on April the 6th, 2020, unless modified by subsequent order. I will sign this now at 11:15 a.m. So 6 hours from now is when it becomes effective. That would be 5:15 this afternoon, so that businesses have some time to prepare for and institute their closing procedures. Obviously, this is not an order that I take lightly, but it is put in place with the knowledge that it will be a serious challenge for our families. It will do financial damage to businesses that close and constitute an impairment to commerce of all types. But it is essential to prevent the spread of the virus, which could overwhelm our hospitals and impair available treatment to our most critically ill patients and loved ones. And despite these restrictions in the order, that are meant to keep us physically apart. We must find ways to become spiritually together through our efforts to support each other. Look out for your neighbor. Look to the nonprofit community led by the United Way of Central Georgia and the Community Foundation of Central Georgia as they announce later today a fund to support organizations serving our neighborhoods, as well as other efforts to directly support people and connect them with needed service. We ask, ladies and gentlemen, for your cooperation and support during this very difficult time, and we hope and pray that this emergency order will have its intended effect to slow the spread of this virus and save lives. Thank you.